we have with us Aditya Uttappa, or Adi, as he likes to be called. He is the Managing Director and Chief Cybersecurity Officer at Accorian, and he'll be providing us an insight into what is HITRUST and the benefits of getting this validation for your company. Adi has spent over a decade in the cybersecurity industry, and not only does he have an addictive smile, but is also a HITRUST expert, leading our team to make sure all our audit validations and processes work smoothly. So without further ado, I'm going to hand over the controls to Aditya. Aditya, would you like to say a few words about your background before we kick off the webinar?
Good evening, everyone. Yes, thank you, Manoj. Good evening, everyone. Thank you for joining today's webinar. I know it's a Wednesday evening. I hope you have your tea and coffee ready. It's going to be a quick introduction into HITRUST and why is it the certification to aim for in the health data security world. So my name's Aditya. I've been in security well over a decade now. I've done everything from penetration testing to compliance across various frameworks like GDPR, NIST, ISO, SOC 2, HITRUST, HIPAA. And today I'm going to give you a little introduction as to why HITRUST and why does it apply to Indian companies that service the world. Before that, I'd like to give you a quick introduction into who Accorian is. Accorian is a full service cybersecurity consulting company, which is headquartered out of the US with offices in the UAE and India. We predominantly help organizations across various services in the security compliance, penetration testing, and monitoring space. We specialize in partnering with small to medium-sized firms and help them meet their security and security goals. And the geographies that we cover are in the US, India, UAE, and Australia. And industries are typically across all the various B2B tech, manufacturing, manufacturing and healthcare is another one. We've been a HITRUST assessor for well over 3 years now. And across the 3 years, we've kind of created our proven methodology for HITRUST implementation and certification. Now, I just like to go over one quick slide as to who we are. So we've typically done about 400 different engagements on the compliance side. And this ranges from everything from HITRUST, HIPAA, SOC 2, ISO, the various alphabets of the security compliance soup. With a team that has an average experience of about 10 years, various types of certifications, various types of industries like health, financial services, B2B tech, e-commerce, retail, and SaaS. And some of the key initiatives that we're looking at are cloud security, because today the world has digitally transformed and moved from on-prem to cloud, IoT pen testing, CMMC, and to name a few. So that's a little bit of an introduction into Accorian. Before I get started on why is HITRUST important, or why is health data security important for organizations in India, I'd like to first give you an introduction into what is health data. So health data could comprise of various elements. It could be your name, contact information, insurance details, medical record numbers, social security number, images, prescription, past records, etc. And all of these combined create your electronic health record. So gone are the days where you have to create a file with a lot of paper records that is kept over years. This is an electronic way of storing all that data. And these have various names, most popularly known as EPHI or PHI, which is protected health information. But they're also called as electronic medical health record, electronic health record. You also have PHR, which is in India. You have the My Health Record in Australia. So it comes with various names, but the concept remains the same, that it's an electronic form of all of your health information, everything from your insurance details to your previous your previous scan results, your prescription, past records, conditions, any unique identifier. All of that goes into this one health record. Now, just like all of us have heard that data is the new oil, it's very important to understand that health data today is the sought after, is very well sought after by attackers today. with majority of them trying to attack organizations with this data set. The reason why is, if I were to compare on the dark web, the average credit card sells for about $10 to about $20 per credit card. Pit that against a health record, which goes at about an average of about $429. The difference is massive, for the simple reason that as various industries get more regulated, so has the health industry also got regulated. So everything runs via these health records that have a lot of critical information about you, but also enable attackers to abuse it, to order any prescription drugs, etc. Right? And also, there's a huge angle associated to abuse and blackmail. But other than that, what I want to quickly highlight is, the average record is, of course, a lot more than, say, a PCI data set, a credit card number. And the average attack in the healthcare sector costs about $6.5 million, which is over 60% of the all other sectors. So this sector is definitely a sector that is being hit by hackers a lot. There is a lot of regulation in place. There are various types of organizations that are ensuring that health data security has to be maintained. And if you're a healthcare organization or a health tech company with all this protected health information, you're typically worried about these things, right? If you see that, I'd like to quickly highlight about the different types of attacks that happen, predominantly hacking, privilege misuse, human error to be some of them. The active motives are 83% financial, with about 72% of pure health record compromise and about 34% of personal data. But 77% in 2019 of all data breaches were associated to healthcare providers in the United States. So now that's a fair number, right? And hence, healthcare companies and organizations that support them have become a lucrative target. So that's a little bit of an introduction into what is health data, what does it comprise, and why is it that one should look at protecting it. Before we go ahead into the next topic, which is associated to, where does health data come from, which entities get exposed to it. Now, you have a patient, the patient is connected to various different entities. It could be a laboratory, it could be a retail pharmacy, it could be a physician group, a hospital, care managers, payers, insurance brands, etc. This is the life cycle of a health data record, where the health data record kind of flows across all of these various entities. Anytime a particular patient checks into a healthcare facility or goes to a store to get prescription drugs or claims insurance associated to their medical treatment. So this is a life cycle. But there's also a big industry that supports this entire thing or entire life cycle from being successful, which is all the vendors, service providers, partners, consultants, infrastructure providers, payer solutions, and SaaS providers. They typically help all of these this entire life cycle to run smoothly, with the patient having a very seamless experience, right? So that covered, health data, its various entities. What is the life cycle like? Now, why is it that it impacts India, and how do organizations in India, get affected by health data security? The simple reason that today, if I were to talk about it, if I were to quickly talk about, India and its support on its role in the entire technology, landscape of the world. We're the technology and service providers to the entire world across various industries, including healthcare and health tech, right? We support them either directly, indirectly. We might be consultants, service providers. We might be technology providers. We might be cloud service providers. We might be, so we play various types of roles. But it's also important to realize that because we support these organizations, we also come into contact with critical data. For this particular webinar scope, it's going to be health data that we're talking about. So we have direct and indirect exposure to, PHI. So whether it's transmission, processing, storage, you could be, you could be a consultant, you could be a service provider, you could be a SaaS provider. You're all touching upon various elements of health data security, of health data, and which is why organizations in India are being, which have a global presence, are being required to showcase health data security maturity to existing customers and partners. And it is table stakes for doing business today. So this is, as part of the entire third-party due diligence and vendor risk management process of a lot of companies, organizations that support healthcare and health tech companies and which come in contact either directly or indirectly with PHI need to start showcasing security maturity. And that's the premise of the entire conversation today. Now, this is a very broad statement where I've spoken about various types of service providers. I'd like to quickly give you a glimpse as to which are those companies that really need to start thinking about health data security. So if you're a health tech which is a SaaS or an analytics company, if you're a software provider for health, if you're an MSP, if you're a revenue cycle management provider, payer solution, hosting providers, and the list goes on. If you're basically helping organizations with lift and shift or digital transformation, employee assistance program, CRM support center. So like you can see, there are various types of categories that that need to start thinking more and more about health data security for the simple reason that because you're working with these global health companies and you're getting exposure to EPHI, you're either being asked about these questions about your security right now, or you're going to be asked about it very, very soon, because health data security today has become very, very regularized. So at this point, I'll just take a pause to kind of reflect over what did we talk about. So till now, we've spoken about health data, what does it comprise, India's role or India technology companies' role in the entire health data life cycle. We've also spoken about what are the different type of companies that need to think about health data security. Now, I'd like to give a very quick introduction into two concepts or two topics which are security frameworks. The first being HIPAA, the other one being HITRUST. Now, when we talk about health data security, there has to be a framework, right? In security, we see ISO, SOC 2, NIST, CSF. There are various types of standards and frameworks. These basically give a way for organizations to understand what would be the controls that have to be implemented, what is the baseline requirement that has to be met, and what is the standard that they have to aim to hit. So HIPAA is a very, very very, very popular health data standard that came out a couple of years ago, and HITRUST is more recent. The HIPAA, of course, was started by the US Congress, whereas HITRUST is a guild which is formulated by various types of organizations, predominantly insurance brands, that needed to create a certification or standard which looks at health data security, right? So when I talk about these two frameworks, I mean, typically, if you're an organization that is in the health industry, you're being asked these questions because, frankly, this is table stakes for doing business. If you're a healthcare company, if you're a service provider to a healthcare company, you're either being asked about HIPAA or you're going to be asked about HITRUST, right? So that's why I've kind of labeled it as table stakes for doing business. I'm going to dive deep into what is each of these frameworks mean. So HIPAA, think of it like a starter compliance framework or standard to look at. It's framework based. It's basically something that's passed by the Congress, but there are some disadvantages. It's non-prescriptive. There's no third-party certification, and there's no third-party independent contractor that provide services in the HIPAA space. That basically really does not help the cause, because there are a lot of organizations that state that they are HIPAA compliant, whereas they may not be following the right kind of rules to call themselves as HIPAA compliant. Pit that against the HITRUST certification. Because this was started by insurance brands to ensure that their vendors and service providers are handling their health data securely, and it's a lot more prescriptive. It has a lot of robust security requirements. It's updated annually, and is recognized as the gold standard for healthcare organizations. And lastly, it's a third-party independent assessor. There are many companies around the world, like ourselves, Accorian, which is a third-party independent assessor. So that's a basic difference. if you go down the HITRUST path, you will basically get a certification, unlike HIPAA, where there's no independent certification or a sign off by an auditor. So now that we kind of spoke about the HIPAA and HITRUST, I'm going to dive straight into what is HITRUST. So, like I said, we spoke about HITRUST. Why is HITRUST important? Why is HIPAA important? I'm going to dive a little more deeper into why do HITRUST. So firstly, because it's a framework, it becomes like this benchmark that organizations can aim to achieve. It also is very prescriptive, so you exactly know what requirements have to be complied by and what is the standard that you're trying to achieve, right? So in turn, you increase your company's security and your compliance posture. Like I mentioned, it's table stakes for doing business. So whether you're working with Aetna, Express Scripts, Humana, or any of these large health related brands, whether it's insurance, payer solutions, or healthcare organizations, they're all going to ask you whether you're HITRUST certified or not. HITRUST today goes beyond healthcare as well. It's being adopted quickly by the travel industry to look at, can this be a third-party certification that they can accept? HITRUST certification also showcases to your customers that you're serious about security and compliance. And lastly, because it's so prescriptive and it's so detailed, you cover both the breadth and depth of security and compliance, right? These are about 19 domains, and this is exactly why I said HITRUST is, fairly covers the length of breadth of security, because it's looking at all the domains across security, whether it's information protection, mobile device, vulnerability management, data protection and privacy, portable media, configuration management, and etc. There are two basic types of HITRUST assessments out there. The first is the I1. This is a brand new assessment that got rolled out in January 2020 for the version 9.6. And this is a 1-year validity assessment. This is typically aimed at allowing newer organizations to adopt HITRUST and showcase health data security maturity. The R2 is a more full-blown HITRUST assessment or a HITRUST program. And your scope varies on how the amount of health data records you might have. Whereas I1 is capped at a certain number of controls. R2 is more for more mature companies who have been doing security or adopting security practices for a couple of years. The I1 typically only looks at implementation of process, whereas the R2 looks at policy procedure, implementation, and maturity of your controls in the form of measurement and management. The I1, like I said, has a fixed scope of 219 controls. The R2, the controls could vary anywhere between 200 to about 900, right? The I1, the disadvantages, you cannot add additional factors like GDPR or the Singapore Privacy Act or Texas Privacy Act, whereas in the R2, you can add elements associated to various types of compliance standards as well. And lastly, the I1 is to be done every year, and the R2 is a full assessment that has to be conducted every 2 years with an interim assessment in between that typically focuses on sustenance and whether you've upkept the HITRUST requirement. So this is a brief introduction into I1 and R2 and the various types of HITRUST assessments. I'm going to talk about the scoring rubric real quick. Like I mentioned, 100% of the score in I1 is associated with implementation, whereas R2, it focuses 15% is on policy, 20% is on procedure, 40% is on implementation, 10% is on measured, and 15% is on managed. So you can clearly see the difference in the two standards and why I mentioned that one is for more newer organizations that are looking at security as a greenfield project for the very first time, as compared to R2, which is for more mature organizations. So how do you choose between the two? Firstly, like I mentioned, if you're going down the HITRUST route, you're definitely being asked by customers, or you want to proactively ensure that you're secure and you have the necessary health data security practices in place. But it's most important to understand, will your customer accept an I1? Or are they looking for an R2? So ask your customers that before you go down, the route of choosing between the two. Think about the number of controls you can implement. 219 versus an average of about 400, 500 controls. It's a massive difference. If you're looking at security for the first time, you'd rather start with an I1 and then pivot to an R2 the next year on. Third, if you're an organization that is spread across the world and needs to think about various other factors and compliance standards like GDPR or the Singapore Privacy Act or any of the US privacy acts, then you definitely, or CMMC, then you need to think about whether it should be an R2 versus an I1. Next is implementation maturity. A lot of organizations might have implementation, but when it comes to measurement of controls, you may not have the necessary framework in place, due to which an R2 may not be the right kind of certification for you. And lastly, the cost. There's a difference between I1 and R2 because of the amount of rigor that needs to be done internally to meet the standard. Secondly, the amount of effort that needs to be put in by an assessor like ourselves for doing the final attestation or the validated assessment in this case. So that was a little, introduction into the two different types of HITRUST assessments. What was I1, what was R2, why should you go with either? I'd like to quickly talk about, if you're looking at HITRUST, irrespective of I1 or R2, what are the things that you should ideally do, and how should you approach this internally? And I'm just going to give you a quick glimpse into our process. So our overall HITRUST certification approach for all of our customers are three-phased. One is discovery, the second is roadmap execution, and the third is the validated assessment. For discovery, it's very, very important to understand scope, right? Your scope defines the amount of internal rigor that you need to put in order to meet that particular certification requirement, also determines cost and timelines. So it's very important to see how big is your scope and can you possibly segment it to whatever needs to be, certified or assessed. Next, understand what controls or what are the requirements that come into picture for your organization. So, do a quick on MyCSF, do a quick assessment to find out what are the number of controls that come into consideration for you as an organization. Third, we basically do a very quick high-level review of your current maturity and identify gaps and assess you against HITRUST and understand what other controls or what are the areas of improvement that need to be worked upon. Next, create a quick roadmap that you can look at towards certification. This would typically showcase how do you remediate various gaps, how long would you require, etc. So discovery, like you can see, is typically a formulation of gap assessment, scoping, and some kind of remediation planning. The next is roadmap execution, wherein all the heavy lift happens, whether it is implementing controls internally, whether it's writing policy procedures, whether it's writing up or creating workflows, whether it's implementing various technology controls. So, in our approach, for phase two, we typically work with organizations to help implement their roadmap, help write their policy procedures, which is about 35% of the overall marking, perform the required penetration testing, and provide program management. And that's typically phase two. After this phase, we typically we would advise customers to then go in for their final certification. For the validated assessment, we audit the final evidence that you've uploaded on MyCSF, look at your rating, assess you, provide our own inputs and the final rating, and then submit the validated assessment to HITRUST for certification or validation. It's very important to call out one little aspect that HITRUST, assesses even the assessor's work. So once we're done with the assessment, we are supposed to send it to HITRUST so that they can review all of our artifacts and all of our audit work. So going a quick deeper dive insight into discovery, like I mentioned, we'll start with understanding scope on MyCSF, how many controls come into picture. Second is we do a quick whiteboard session to understand where does your PHI lie, what are your boundaries of risk, and what contractual obligations do you have. Next is do a control by control analysis of current state and understand whether you're meeting HITRUST requirements or not. So we do it by interviewing stakeholders, reviewing all of the evidence in place. Once we have this, understanding, we'd be able to, understand your significant gaps, highlight them, and call out gaps in your policy procedures or implementation. And lastly, create that roadmap that needs to be in place so that you can go ahead and implement HITRUST, and then call out effort, call out, tasks, possibly work with you in figuring out ownership and budget to address some of these gaps. So at the end of phase one, you typically know how long you're going to take to hit HITRUST and what are the things that you need to implement, or what would be the next steps in order to go down that path. So that's phase number one. For phase number two, it's all about roadmap execution, and Accorian, of course, provides assisted services. Everything from figuring out what kind of technology controls you need or what vendors you need to have in place. So whether it's for MFA, single sign-on, endpoint security, patch management, access control, firewall maintenance and management, whether it's 24/7 security monitoring, we can help bring the right set of vendors. Additionally, over and above that, that's associated with technical controls. We'd also help in expediting the entire HITRUST process at your end by updating or writing up new policy procedures that are in line with HITRUST, formulating your workflows, program managing the entire effort internally to make sure all stakeholders, whether internal or external, are working towards this particular goal. And lastly, providing penetration testing services. So that's phase number two. At the end of phase two, typically organizations are a lot more secure and ready for the final HITRUST validated assessment. For the final validated assessment, we typically have about 2 to 3 months. And to conduct this particular assessment, I want to call out a word of caution that before we get started on validated assessment, organizations have to ensure that their controls have been in place for at least 90 days of steady state and about 60 days of steady state for their policy procedures. So that's very, very important to understand what level of maturity you need to provide. Also, once we have this information, we start the full assessment, we review all of the evidence, assess your security maturity, and then finally formulate the final score, provide our inputs, and submit it for HITRUST with our recommendations for certification or validation. The pass mark for HITRUST is 75%, and that is something that can be very easily achievable by simply implementing your policy procedure and your implementation, which would then bring you to a score of 75%. That's phase number three. So this is typically, at this point, I'm just going to take a small logical break. I spoke about the various types of assessments. I spoke about the 3 phases and how you can better manage your internal HITRUST implementation, and also showcase how does Accorian help organizations run their HITRUST program and achieve certification. These are some typical overall timelines. This could vary based on the internal buy-in and the amount of effort you're putting in. But discovery takes about 2 to 3 weeks. Roadmap execution could be 2 to 8 months. Steady state, like I mentioned, is for 3 months. And the validated assessment could be between 2 and 3 months, right? So this is the overall timeline. This could be a lot lesser, except the steady state that is not negotiable. You have to showcase 3 months of steady state for controls. All right. So with this, I know we're up to time, but I'd love to get to know your thoughts, help answer any queries that you might have about the entire process, and give you a little more insight. Along with that, this opens up the Q&A session. For those of you who joined us and would not be staying for the Q&A session, thank you so much for your time. I've also provided my details here so that you can reach us if you have any queries. That opens up the Q&A round. Okay, so I see a question here that is associated to, okay, so this question is about whether the HITRUST certification requirements are similar across various sizes of organizations. So I'm going to put it this way. if you're an organization that needs to showcase HITRUST certification as one of your artifacts to your clients, then irrespective of your size, the controls will be very similar. Yes, the implementation rigor would be different, but the controls are not determined on your size. They're determined on the amount of health records that you might have internally. I guess that's all the questions that we had today. So thank you all for your time this evening. I hope this was insightful. I'd love to hear from you. You could always drop us a line on LinkedIn or drop us an email. And I'd be happy to talk about your HITRUST program and how you could achieve this. Thank you and have a great day.